Well, I was born up in the upper reaches of the Paraguay River in South America, close to the big area known as the Pantanal, which is part of Brazil, Bolivia, and Paraguay. My father was a worked with a company that extracted tannin from a hardwood a plant is called breakaxe, quebracho, and I was born there. And then when school time came, we came to the city so I could go to school. Well, then I went to the from high school. I went to the army, where I met another group of people extremely interesting. I did my military service 1 year with the French military mission, a mission of a military academy of higher education. And there we had just finished a war with Bolivia, the Chaco War, and the school was a 2-year school taught by the French staff. I remember so well that my professor, the one who was to be my professor of surgery, Manuel Riveros, was at that time doing a fellowship at Memorial Sloan Kettering, and we had just in the throes of a civil war. And then when but I was waiting for him because I was thinking of doing surgery. And I waited for Manuel Riveros. When he came back, I talked to him, and I said that I wanted to be a resident in surgery. There was a choice for me. It was either engineering or medicine, were the two, because the university, the higher education horizon was very narrow. Okay, and I am not. There was nothing else that attracted me. So I went into medicine, to which I was already attracted. But as you know, medicine is such a very large a discipline that has, and then of course you have to, and surgery is usual. You know, you're new and you go and you see the drama of surgery, and when it's fascinating, and I really loved the idea of being that. I was an instructor in surgery. I was not. It's like a glorified chief resident, and but I was teaching the medical students and reading and working the bibliography. When we had one of the most devastating wars in which Paraguay has been. It was the Civil War of 1947, and we have been living the consequences and of all that. But nevertheless, the Civil War divided the country. The way the big war of before and the war of the Chaco never did. Paraguay, the Paraguayan society, it was totally destroyed. I mean, the national fabric was destroyed. There were a tremendous amount. I'd never seen that before, and I never want to see it again. I did what is called general surgery, and that was, but general surgery is is very loosely defined depending on where you are, particularly in this country. But here in Wilmington, you did skin lesions. We at that time were doing fractures, we're doing trauma, we're doing a work in the emergency ward that needed surgery. Then, and that was something that one of the first things for me was a uh, very well defined picture, because when I came from Paraguay and I came to Memorial in New York, and Memorial had departments. For instance, it had, and I'm talking about the surgical side of it, when it had a gastric and mixed tumor service, had a head and neck service, gynecology service, in all this thoracic. The only thing we did not do was neurosurgery. That was done at Cornell. It was sensational. It was anybody that in my field or my stage of life would come and tell me that he was bored. I could not understand it. I think that person needed help. And things were happening from 1954 until now. A woman found a tumor. A doctor found a tumor, came to the surgeon does a biopsy, proves that this is cancer, and it does a radical mastectomy. The radical mastectomy with very small variations is being done the same as what else. And then comes the mammography, and we are operating on tumors that are not palpable. We can see them, we cannot feel them. So we are talking about tumors that are at a very early stage, and that is where the window of recovery, and we don't use the word cure when we're dealing with breast cancer. And it is through that window, then the next window is going to be the other one, in which we will be able to prevent breast cancer. The academy is something a little bit not in the main current of the daily work, the daily travail. It's an institution where a distilled, proven knowledge is accumulated, is put down. But it is also, you had to see that. You had to see through it when that academy, it's a big sounding name, and then you can get your insignia and whatnot. But you accumulate knowledge there. The function of the academy is to make use of the knowledge to the people. In order to do that, we need programs, institutions, and of course that requires money, dedication, work, and all that. But those are tools. The medical sophistication, breadth, and quality of medical care in Delaware is outstanding. And you can compare it with anything in the world. I'm not saying just the United States and the world. With really an outstanding what do you call it? Aggregation of services and whatnot. We really are on one of the very highly developed areas, programs of medical care. And Christiana Care is at the forefront of that. There's no question. Of course, there's the Alfred I Institute, the tremendous contribution of St. Francis Hospital, in the hospitals in the rest of Delaware. We're a very fortunate people to have this kind of medical care. It has the, that we have, it's a very, very human thing, affliction, if you want to, you started realizing your capacity and your energy and whatnot. And there's always a point that said you get up to the point that you know everything. And it may be true, but the perilous, the dangerous moment comes when you start to believe that you know everything and whatnot. You really need to meet with other people. And it's enriching just to talk to people who may be doing different kind of work and getting together. That is the value. Exposure to others. You come to, and the Academy is one of the organizations that can and should fill that role.